and most of our doctors are having very good handwriting, and it's very difficult to read anyway. So it's better if you just try to make it up to date and not based on paper. So the importance of EMR is basically the physicians and staff can respond swiftly, accurately, at the same time, ensure, just a second, I've got problem in here. Sorry. Yeah, to ensure the compliance. It's a unified communication platform to access reliable information. It identifies patient due for screening and plan preventive measures. It improved health diagnosis, treatment, and overall quality of care. I'm sorry, there is a small puppy here. It's just annoying, but it's fine. Solution for all departments there by bringing down cost per unit. And then the benefits of EMR for healthcare is seamless access to patient data to various stakeholders, identify patients' waiting time, and work out mitigation plan for a smooth flow of patient. It also has improved result reduction in human errors in your medical practice. Reduce operational costs such as the storage of transcription by going paperless, customizable and scalable according to the way you run your practice. And what about the Wink EMR? What is special in this software is it is very comprehensive software for ophthalmology and optometry practice. It designed using latest technology to meet growing business needs of large or medium hospital, including single doctor clinic. It stores data and images in electronic format for easy retrieval and use. Provision to draw and upload equipment images. Connect various stakeholders, administration, like many parts of your hospital, including optometrists, ophthalmology clinic, optician. Specialty-based solutions such as cataract, glaucoma, strabismus, and dry eye are available. And now here we have Mr. Ganesh with us to explain you more detail about this software. But the little introduction about him, he is holding master in business administration. He has more than 2 decades of IT industry experience, and he has entrepreneur for many years, founder of organization, heading sales and marketing. He's expert in offering appropriate consulting service, customized software development, and also infrastructure development. Domain expertise in healthcare, banking, microfinance, and supply chain. Very welcome, Mr. Ganesh. Hello?
Yeah, thank you, Beta. Thank you for your introduction. Yeah, good day to all of you.
Pleasure. How are you?
I'm fine. How are you? How are you?
We are waiting for you to just explain us more about the Wink EMR.
All right. Okay. Right. Yeah. Before I proceed with detailing more about the product, I would like to give a small introduction about the company, about the product. In continuation to whatever Beta has given a short introduction. The CMPS is the organization name, and the product is called Wink EMR. The organization was founded in the year 2009, and we are a NASSCOM shortlisted company for its innovative product. NASSCOM is a body for an Indian organization which sells the Indian capability globally. And we are also the early player to adopt cloud and mobile-based solutions. And where many of the organizations were actually experimenting, we already launched the product in the year 2009 on various other domains. And we have successfully implemented very large enterprise projects for various segments, including healthcare, supply chain, banking, and microfinance. So this is a short brief about the organization. And a small introduction about me is, as Vita said, I founded this organization. I take care of sales and marketing with more than 2 decades of experience, with a variety of experience on various verticals like healthcare, banking, supply chain, and microfinance. I also have with me Mr. Dinakar, who's also taking care of the product development. He's a technical architect. And like me, similarly, he has a 2 decade of IT experience with a strong domain on healthcare, finance, CRM, and manufacturing. I wanted Mr. Dinakar to do a small self-introduction about him before I proceed with the product demonstration. So now over to you, sir, Mr. Dinakar.
Hi everyone, this is Dinakar this side. I'm very happy and fortunate enough to be present in this forum. Uh, very well privileged enough. And about me, I got some experience on the healthcare and the other domains as well. And I got about 20 plus years of experience over there in this field. And we have worked out on the healthcare domain also. I got some experience on the healthcare domain too. So I've been working with Mr. Ganesh for quite some years now, and we have just come out with this product called Wink EMR, and we have developed it exclusively for the ophthalmology segment. And I'm definitely very sure that this Wink EMR will serve and the clients will be very much benefited by this. And thank you very much. I hope you will enjoy this session with us. Over to you, Ganesh.
Thank you. Thank you, sir. Thank you for your small introduction. Yeah. So now I proceed with the product as in continuation to whatever Beta had already told. Um, Wink EMR is a comprehensive software specifically for ophthalmology practice. Though there are many software, either they are in electronic health records, very few are in electronic medical records, and out of which very few of them are in ophthalmology practice. Our specialty is on the ophthalmology side. And we have designed this application using the latest technology, Google Angular and Microsoft .NET. So these two technologies were used to develop this application. And the application primarily is used to store the clinical data and images and retrieve it for various clinical uses. And the biggest advantage of this application is basically where an ophthalmologist can draw images and also upload the images, connecting various equipments. Those are some of the advantages of this application. And we are also connecting various stakeholders who are using this application, be it a reception who does the patient registration, an optometrist who does the refraction, records the refraction data, as an ophthalmologist who does the findings and examination, and the opticians and the pharmacists who issues drugs and glasses. So the entire stakeholders who are using this EMR will be benefited, and the data flows seamlessly within the organization. And the specialty that we are currently covering are cataract, glaucoma, strabismus, and dry eyes. And there are many more specialties that needs to come over a period of time. And
Mr. Ganesh, sorry to interrupt you. Sorry to interrupt you. Could you please share the screen with us so we can see simultaneously the PPT also?
Okay. All right, you're able to see the PPT? All right.
Yes, that's clear.
Okay, so the modules that are being offered in this Wink application is basically it starts with the outpatient module, which has the feature of appointment fixing, patient calling up the hospital or a clinic where they take the appointment. The next is once the patient visits the clinic or hospital, the registration process is being handled, where we collect the demographic details and patient history, current his ocular complaints and the systemic conditions are being recorded in patient history. And the optometrist records the refraction readings, and the doctor records the findings and examination details and the investigation details. And issues the medical and optical prescription. So these are the screens that comes under the outpatient features. And the next thing is the inpatient, where if a patient is being recommended for the surgery, the counseling and the admission process is being covered in the inpatient module. And the pre-operative procedures before the surgery are being carried out in this pre-operative session, and the intraoperative during the surgery, various vital details are being recorded. And the post-operative, basically the medicine and the other details are being recommended here, and the discharge, finally the discharge summary is printed in the inpatient module. Apart from that, the optical and pharmacy module will have the customer order, where the customer places an order with the store which is available within the hospital, and the hospital plays a back-to-back order with the vendor, and also the stock summary is also being tracked using this Wink application. The biggest advantage of using Wink EMR is, though it's a product, we are willing to customize based on the industry requirement. And the other advantage is the country-specific payments and insurance claim process can be integrated using third-party integration. And the product is designed to run both on cloud as well as on local servers. And the product, using this product, the hospital, if they have multiple branches, they can configure multiple branches under one single application and can track the activities of various branches from one single location. And by connecting all the branch, the biggest advantage is also the inventory tracking. The stocks available at various units can also be tracked. And for a management, they can make a quick decision process by getting to have the information across various locations. And the application is secured, scalable, and integrated with messaging services. When I say messaging services, both patient and the doctors and the other stakeholders are kept informed through various messaging services. And the product supports multi-currency, and the access privilege is one of the biggest benefit of this application, where you can control the access of data. The management can decide who can control what kind of data. Those access privilege feature is also available in this application. So by customer choosing CMPS, they stand an advantage. One, because CMPS works as a partner with the customer, as we are interested in your long-term solutions. And we have an adequate experience in healthcare and can definitely enhance the clinical process. And we are also a vendor who just don't sell technology and walk away. We work with the customer in terms of meeting their expectation. And for the customer, the advantage they get is, as I said, at the reception front, they can store the patient demographic details in an electronic format, and they can do appointment booking based on the doctor's availability. And this systemized periodic reminders to patient through the system itself. So the system will automatically send all the reminders to the patient and to the other stakeholders, and we can configure at what stage the reminders has to go to every stakeholder. So that is also an advantage at the reception end. And for the optometrists, they can capture the refraction, visual acuity, and retinoscopy details. And they also have the provision to seek the second opinion from any other ophthalmologist, and they can generate the optical prescription. This is for the optometrist. And for the ophthalmologists, for the doctors, they can draw various images, the slit lamp images or the fundus images, and they can upload those images, and they can issue investigation prescription and the operation theater notes, which is a very important feature in the inpatient module. So we have an operation theater notes features that is beneficial for the doctors, and they can also maintain and track the inventories at the operation theater level. So these are some of the advantages as an ophthalmologist that they get. And for an optician and pharmacist, they will receive the prescription automatically. The need for somebody to send an email prescription doesn't arise. Once the doctor submits the drug prescription or the glass prescription, the respective users can log in and get to see the prescription automatically. And based on that, they can issue and request drugs, glass, and frames. And finally, they can also track the inventory and maintain a reorder level also. And for the management of the hospital, there are some key reports and analytics that are available in the management dashboard, and the multiple branch activities can be tracked from one single location. And as I said, this being a cloud application, you can access it from anywhere and anytime. And the other key features is the data security, where the security certificates are being appropriately installed, and so the data security is very well protected. And data backup is taken at the regular intervals, thereby avoiding data loss. And the server downtime is ensured with an SLA of 99.99% uptime. So these are some of the security measures that we have taken at the server end. And what is ahead? Where are we now going towards? The road ahead for us is, as I said, we have already built few subspecialties in the application. So the other subspecialties that are in the agenda are the cornea, vitreoretinal, uveitis. These are some of the other subspecialties that we are exploring to those features to be brought in inside the Wink EMR, and the machine integration with equipments where the human error can be avoided. The images and the data from the machine can be directly uploaded into the Wink EMR rather than doing a manual upload. And the artificial intelligence is one area which we're also exploring, which helps in early detection of some of the eye diseases. So these are the road ahead which we are working now towards. So with this, a small presentation about the company, about the product is done. So if you have any queries, then I would like to clarify before I proceed with the product demo. Yeah, anybody has any questions, I'm willing to clarify.
Yes, they can write a question on the question box, right? And you will just directly see them and we'll just answer them. So you can write your question.
No, I would want the participant to put in their questions so that we can answer if there are any.
Yes.
They can put it in the chat box. Any questions?
All right, I think let's just carry on. So
right.
if they have any further question, they just keep writing and you will see them.
All right, okay. All right, so now I proceed with the product demonstration. So this is the product that we were talking about, Wink electronic medical records. So this is a cloud-based application. You're able to see my screen?
Ganesh, you need to
Yes.
have the.
We just have your PPT, which your last slide.
Yeah.
Right. Yeah.
Okay. So this is the application that we were talking about. So once you subscribe to this application, you will be given a username and password. So you type in the username and password. Sir, can you log out of this?
1 second. Yeah.
You're logged out. All right. Okay. So this is also one of the security measures that we are talking about. So simultaneously with the same user ID, people cannot log in. So just in case, if somebody else is using your ID and logging in, it will not allow you to log into the system. So there will be an automatic email that will be sent to the registered email ID. So by clicking that link, the person who's accessing the application without any authorization, he will be logged out, and the registered user ID password can be accessed by the authorized user. So this is one of the security measure that we have also taken in this application. So now I'm logging into the application. So this is the organization name that gets listed once you log in. And as I said, it's a multi-branch application. So I choose the particular branch where I need to access this application. So I'm choosing one location. So this is the dashboard that you will see once you log into the application. Before I proceed with the dashboard, I will take you through the appointment screen. So the appointment screen is the screen where a patient calls up the clinic, and the reception is going to collect the demographic detail of the patient: first name, last name, date of birth, gender, the phone number, and if there are more than one doctor consulting in this particular clinic, then for which doctor they need the appointment date and the time, and what is the purpose of visit. All of these details are being captured and then submitted. So this completes the appointment screen. Then now I move on to the registration screen. So once the patient takes the appointment, the patient visits the hospital. So that's where the registration process starts. The reception is going to collect the demographic details of the patient. If a patient has already taken the appointment through phone, and if the details are already captured in the appointment screen, the data will automatically come in the registration screen. Assuming if the patient has not taken the phone appointment and if he directly walks in, then we will straight away start with the registration process. So there are two categories. One is a quick registration, other is a detailed registration. In the quick registration, we collect the first name, last name, gender, with age and phone number, and whether the patient has an artificial eye or natural, is going to pay through insurance or going to pay from his pocket, and what is the registration fee. So this is where the multi-currency feature is also enabled. So let us assume if it's going to be $10, then the payment mode is also being captured here, and what kind of payment, whether it's going to be cash, check, credit card, debit cards, whatever details are being captured. And there is a general consent that is available specific to every hospital. We'll customize and give it. Apart from the text consent, we also have an audio consent recording where you can hand over the speaker to the patient and you can record the voice of the patient. And if you want a video recording, you can also make him stand in front of the web camera and take the video consent. So all the three modes of consent recording is available from the for the patient to register. And the detailed registration will additionally capture the communication details, the identification details, basically the government ID proof details. Those details are also being captured, and the kith and kin details. So these four details are captured in the detailed registration. Otherwise, not much of difference between the quick registration and detailed registration. So now with this, we complete the appointment screen and the registration screen. Now I move on to the dashboard. So this is the dashboard that we saw when we log into the application. As I said, for convenience, I'm splitting it into appointment patient, new patient, review patient, and surgery review patient. Okay. So all the four categories of patients are will come under respective category. So let me take one example of one particular patient by name Roy Frederick. So Roy Frederick, we are going to start with the patient history. So whatever the ocular complaints he has, those details are being recorded. If there are any new ocular complaints, you can use this plus button to record the ocular complaints. Similarly, the systemic condition, if he's a diabetic or a blood pressure, so any other new systemic condition, you can use this plus button. And the current medication that he is following, whatever the medicine that he is currently taking for whatever reason, those details are being captured here. Apart from that, the general family history can also be recorded here. These are all free text for the doctor to type. So with this, we complete the patient history. Apart from that, we are also capturing the allergic details. So what type of allergy patient has, whether he has a drug allergy or a food allergy. Those details are also being recorded from which period that he has that. So allergy details are being captured. And the vital signs like pulse rate, heart, blood pressure, temperature, those details are being captured in vital. And if he has already undergone any previous surgery, those details are being also captured in the surgery history. So with this, we complete the patient history screen. All right. Now I move on to the refraction. So this is the patient whom we recorded, Roy Frederick, with the registration number, the age, and the gender. So you will see all these four details across all the screen till the entire process is completed. So this is the refraction screen, and this is basically an optometrist screen. So the optometrist is going to capture the visual acuity here. So the category of the visual acuity, whether it's aided or unaided, that is being captured here with the distance vision, near vision for both OD and OS we are capturing. And the present glass prescription, so the spherical, cylindrical, and axis for both OD and OS we are capturing. And the refraction using what instrument, whether it's AR, refraction instrument, retinoscopy. So we are capturing the spherical, cylindrical axis for both OD and OS. This is before dilation and after dilation, dry and wet. So with this three details we are completing, and optometrist is going to now punch her acceptance value for spherical, cylindrical, and axis for both OD and OS. And apart from that, the optometrist is going to capture the binocular PD and the monocular PD value. And if there is an optician available in the hospital or a clinic, then optician, the same data, whatever is being punched by the optometrist is going to come here. The optician will have the privilege to do any minor corrections here, and he can also save it here. And the color vision test using number of slides that being captured here. If it's normal, it's normal. If it's defective, how many slides are defective is captured here with the description. And we're also capturing the squint details. If the patient has squint, what type of squint that we are capturing. Apart from that, the AMSLA detail for both OD and OS we are capturing. So with this, we complete the refraction screen. Okay. Now I move on to the finding screen. So this is basically the doctor screen. So whatever the optometrist has punched in the previous screen, those details will come on the right hand side, and the same details doctor can verify, and if he is okay with those readings, then he can just have to put the tick mark. The same details will come on the left hand side. So I'm going to choose the same, the readings are right, so all the details are going to come on the left hand side. Apart from that, doctor will have an additional responsibility of capturing the intraocular pressure details, so using what kind of tonometry, whether it's an applanation tonometry or non-contact tonometry. So those details are being captured here before dilation and after dilation. And then we come to a slit lamp. So in the slit lamp, we are going to capture the anterior segment details. Apart from the anterior segment, we are also capturing all of these details. Assuming if the patient is normal in the slit lamp observation, he need not choose all of these descriptions. Rather, he can just in a tick mark this normal. And the doctor will have the option to draw and also upload any specific images for the slit lamp for both OD and OS. So this is one of the features which I highlighted during the initial presentation, where the Wink application will have the facility to draw and also upload images for slit lamp. And again, in fundus, we are going to capture the posterior segment details. Apart from that, we can also capture all of these details. And here again in fundus, we are giving an option to draw and upload images, any fundus images if you have, for both OD and OS. So if you have any doubts till now, I'm willing to clarify, else I can proceed with the next screen. Any doubts? People can send me a chat message. I'm fine with that. Any questions till now? All right. So now I proceed with the next screen. So now I move on to the diagnosis. So we have listed some sample diseases here with the ICD-10 codes. We follow ICD-10 codes, and for ICD-10 codes, we have listed few sample diseases. So if you want to add anything, you can use this plus button. And there's a treatment and advice, which is the free text for doctor to type. And the next review date is also being punched and then submitted here. Based on the diagnosis, if doctor suspects any of these diseases, let's say glaucoma or cataract, so if he wants to do any investigation, so for this glaucoma, what are all the investigation that needs to be taken? So we can do those investigation. We can just add and then submit. The investigation prescription gets generated. And based on the investigation prescription, the latest images can also be uploaded here. So you can choose the investigation and you can upload those images. So So that also is possible. And based on the investigation image upload, if doctor recommends a surgery, and as I said, if it's going to be glaucoma, what type of procedure that he's going to do, you can choose the pre-glaucoma specified and for which eye, and then you can add, and then you can submit it. So, and if there is the proposed surgery period can also be mentioned here, and then you can submit. So with this, we complete the outpatient flow. So this is applicable for the clinics and an optometrist who does the refraction and wants to record all those clinical data. They can use up till this surgery. And there is also a medical prescription. So there are some sample medicine that we have already keyed in here. So you can use the medicine, whatever the medicine that is applicable. The medicine name will automatically get reflected based on the disease, and then you can just give a submit, and then medical prescription can be issued. And similarly, the optical prescription can also be issued. Whatever the optometrist has punched and whatever the optician has confirmed and whatever the finally the doctor has agreed to it. So those details will automatically come here, and you just have to do a print. An optical prescription will be generated. And finally, it's a total history. So the entire history of this particular patient, Roy Frederick, as I mentioned, be it his refraction history, his finding history, list of medical prescription issued, list of optical prescription issued, list of investigation prescription issued. So the entire history of this patient, right from the time he visited your hospital, that will be available in this total history menu. So with this, we complete the outpatient module of Wink EMR. So any doubts, I'm open to answer your queries.
Yes, Mr. Ganesh, I've got one question that if you can see or you want me to read it for you.
Yeah, you can. One second. Can we do a digital signature of the clinician in this software? Digital signature, we have not currently integrated the digital signature at this point in time. But as I said in one of the presentation, in the initial presentation, integration to machine digital signature or any other integration, payment or insurance can always be done based on the third-party application. So if the third-party application is able to give us the open up the API, we can integrate that API with Wink EMR API so that the digital signature can also be enabled. Sir, if you have, Mr. Dinakar, if you have anything to add, you can add, sir.
Like what Mr. Ganesha said, yes, Wink EMR is open to the integrations, and we can integrate our application with the third-party software. So absolutely, absolutely, that should not be a problem at all. So the scalability is always available in the Wink EMR. So we can take it on a case-to-case basis. So that should not be a problem.
Yeah, thank you. Okay, with this we complete the OPD. Just want to understand if people would be also interested to see the IPD based on the profile that they carry. If they are an optometrist, they may not really look for an IPD module unless there is an ophthalmologist who may want to know something about what is available in IPD. So I would be happy to understand if people would be keen to see the IPD module also. Any interest? All right, okay. So there is a request. So I'm logging into an application which will have an IPD feature. So we have seen till the surgery recommendation by a doctor in OPD. So once the doctor recommends a surgery for a patient, then the patient will first undergo counseling with the counselor. So The counseling screen is available here. So the counselor is going to sit and explain every stages of the operation to the patient and going to take the patient confirmation whether he's interested to go ahead with the surgery, and the surgery scheduled date and the room type and the room status and the type of lens that he wants. There are some counselor checklists that are available. So the counselor can, based on the checklist an hospital decides, the counselor will discuss with every single patient some of the checklist, and once there is a discussion that is done based on the checklist, that he or she is going to give her consent that these are the points that has been already discussed with the patient. And if the counselor is allowed to take any advances for the operations, here we can also, she can also collect the advances, and there is a consent that is available again before a surgery is being done, so that there is a consent, so we can take the consent from the patient. So this completes the counseling screen, and then I move on to the admission. So in the admission, there are three stages: the pre-operative, intraoperative, and the post-operative. There are three stages. So in the pre-operative, it's basically an anesthetist who is going to perform all of these. Okay. Uh, so let me choose a particular patient. So there are some surgery safety checklist for the anesthetist before the induction of anesthesia, and the anesthetist check some of the pre-anesthetist history like cold, cough, fever. All of these details are being captured here in the PAC history. And if an anesthetist wants to do examination, he can do the examination of all of these: height, weight, body mass index, respiration, blood pressure, temperature. All of these details can also be recorded in the PAC examination. And if he wants to do an investigation, it could include blood count, urea count, and all of these vitals are also being tracked in this PAC investigation. And if there is an instruction that he wants to give to the doctor who's going to perform the surgery, so those special instructions are being captured here, including the number of units of blood that may be required during the surgery. That is also being captured in the pre-operative. And then I move on to the intraoperative. In the intraoperative, as I said, if the patient is going to undergo a glaucoma surgery, so what surgery is that? The procedure of the surgery is being recorded here, and if there's any additional notes that are being captured. So there are some surgery safety checklists that you can see before the skin incision and before patient leaves the operating room. And the anesthetist during the surgery is going to record all these vitals, and the intraoperative, the kind of drugs that are being used during the operation, and the intraoperative notes. As I said, glaucoma being the surgery and trabeculotomy being the procedure. There are some standard set of 9 notes that we have keyed in for demo purpose. So if you want to add any notes, you can use this add button. If you want to remove any notes, you can use this delete button. So with this, we complete the intraoperative. And then the post-operative. So in the post-operative, whatever the surgery details for this particular patient that is being tracked here, and the medicine that are being used for the post surgery, what are all the medicine that needs to be used and followed, those medicines are being prescribed here. And finally, the discharge. So in the discharge, so let's assume Joseph being the patient. So the discharge summary, so the patient details, the surgery that has been performed, the discharge details, and medicine prescribed. You can view all of these, and then you can just give a print, which will the system will automatically generate a discharge summary. So with this, we complete the post-operative discharge also. So with this, we complete the inpatient module. So you have any doubts in inpatient and outpatient, I'm willing to clarify. Otherwise, not much. We are almost through with the demo. So if there are any questions, I'm willing to answer those. Yeah. So with this, we complete the no questions received. So I complete the demo of both inpatient and outpatient of Wink EMR. Now, Beta, now I'm through with the demo. So now we can now have a small Q&A session in terms of clarifying any of the doubts the audience may be having so that we can take it forward.
Yeah, but before Q&A, I must tell it was very interesting for me because your background is not medical and you know each and every details about the testing names and procedure related to ophthalmology and optometry. That's very good. That means you know what you are doing.
Yes, it's a journey of last 2.5 years. We've been sitting with doctor, though we are not doctors. We are just an IT professional. In fact, Mr. Dinakar has put in a lot of effort to sit with every single doctor, whomever he has met, and taken a lot of medical related inputs. And like this session, he has conducted many sessions in last 2.5 years with various doctors, understanding the inputs, how from the doctor perspective and optometrist perspective, how they want to look into this application. So there's a lot of hard work that has already gone in, and we are still working on a lot of improvements, bringing more subspecialties in this application so that we can address the mass.
Right. Okay, so if anybody has any question, please write your question on question box and Mr. Ganesh will just answer
Yeah,
you.
yeah. Somebody by name Mr. John has asked what is the cost of the software. The cost of the software, as I said, it's a business application. We need to work out a cost in terms of your requirement. So the cost can be determined based on the requirement. So you have a requirement for a particular module. You have a requirement for this many number of users. So the cost can be arrived based on various inputs and along with the customization that needs to be done based on your practice, the way that you practice, what kind of customization that we need to do. So the cost is worked out based on three different factors. One is the number of users that you need, the modules that you need to access, and the amount of customization that the product needs to undergo to fit in your requirement. So once we have all of these inputs, then the cost can be worked out and sent as a quotation. Yeah. Next question, anybody?
Mr. Ganesh, as we talked earlier, you said there is some a free training session for our audience, right?
Right.
So can you explain about that?
Yeah. So now that we have given the demo of this application, what we want to see based on the doctor or an optometrist interest, if they want to start using the application, because last half an hour, 45 minutes, we've been only doing a demonstration of this product. It is only going to, we have only given a glimpse of how the software looks like, but the real feel of the software can be experienced only once they start using it. So there are some prospects who may be interested to try their hands out in terms of using this application. So for that, we have a provision of subscribing, yeah, the prospect, whoever is interested to try this application. So we give them a free trial access to this application, and we create a username password for them. So we just don't stop with that by giving them a username and password. So we get to work with them closely, give them a training, one-to-one training in terms of how to do the data entry of their clinical data in this application, and get the real feel of what they actually want from this particular application. So we offer a trial access to this software. Apart from that, we also offer a training how to use this application. So both we can give it to the participant who's interested to know more about the software and also understand how much it fits their practice. So we can enable both of these based on the interest that we receive from them.
Yeah, thank you so much. Would you like to add anything more before we just wrap up the session?
How an optical person or an optometrist can be benefited by this product. there is a request that has come. As I said, optical person, the optical person, an optician. So whatever the optometrist has keyed in, the data of those refraction, the glass readings will automatically come. So the need for somebody to send a prescription to an optician does not arise. The optician will log in using his credential, and he will get to see the prescription that are in queue. So he can click the patient, and he can see the optical prescription. Accordingly, he can issue the optical glasses. Apart from that, this is just one part of the application. The other part is the optician can get to know the inventory of glasses, frames. He can track the inventory of these glasses and frames, not just his location, but also across various locations. So just in case if he wants to place an order, back-to-back order to a vendor, he can do that, and before he does that, he can also check the inventory at various locations. So if the inventory is available in a different branch, then he need not place an order to the vendor. Rather, he can just lift that inventory and supply it to the customer. So for an optician, definitely yes, it will be useful. It is not just the bill that he's going to generate. There are many other information that is available for him to really gauge in terms of the application. And the optometrist, as I said, the optometrist can do the refraction, and they can straight away issue a glass prescription. So they need not, for the first level patient, they can straight away issue all of those prescription and records the electronic data of the clinical readings for an optometrist. So they both benefit by these features. Sir, you have anything to add, sir?
No, in fact, we have got the next question, that can we extract data of the for the research purpose? Yes, we can extract the patient data in the soft copy. We can export to PDF or to the Excel sheet or to a Word document. We can just export the data in terms of the patient case sheet and all that. You can export it. Absolutely not a problem. Yes, we have the facility to export it. Yes, extract data maybe for any kind of a format. Yes, it can be done.
Yeah. Any other questions? Yeah. Before we wind up, any other questions we can
Yes,
clarify?
there is one more question regarding the extracting the data, if you can see, from John.
Yeah, I think Mr. Dinakar has already
I think I
responded to
just
this
Oh,
question.
all right. Oh, yeah, that's the same one. Okay, Ganesh, if they want to just try that free training, and as you said, they have the feeling of how this software work, how
Right.
they can approach you? Can you just put some email address or any contact information you have so they can reach you?
Yeah, the request can be, yeah, Mr. John has again asked whether it's a perpetual or subscription. Sir, you can answer this, sir. Dinakar,
Yeah,
sir.
we have both the models available in the Wink EMR application. We also offer the subscription model, and on the on-premises model also we offer. So depending upon your requirement, depending upon your need, yes, it can be no, it can be done.
Okay, the request for trial beta, you had asked me for a request for the trial. The request can be, we have a feedback form that the prospect who's interested to try out, they can fill up the feedback form and they can send it by email. So once we receive that feedback form, then based on the reply, we could activate a trial access to that particular user. So we will send the user credential to that email so that they can start using the application. But before they start using the application, there will be a small session, training session that we will do in terms of how to handle the application, how to navigate the application, and what kind of data that needs to be punched. So that small session will be handled before we hand over the user credential to the user. So the request for free access to the application can be sent uh, through the feedback form.
Yeah, all right.
Any other questions?
Yeah. Um, someone is asking that is there any exclusive for audience of Vision Science Academy?
Exclusive?
Yeah, anything special that people are just taking part in here, so they have the referral of ours, any offer basically.
Yeah, as I said, we can give them the free access to the application. Apart from
Oh,
that, if there is anything specific that they would want, expect from us, we can do that also. That's not a problem. And they can also get to, no, as I said, they have undergone this demo session. So we can also issue a participation certificate that they have undergone this session. And um, as I said, we can give them an access to this application also. So
yeah,
that comes by default to your organization.
right. So if you want to add anything, please go on. Otherwise, we have to say goodbye.
Yep. I think I'm through with all the information. So unless there is any specific query, then audience would like to put.
Thank you, Ganesh. Thank you, Mr. Dinakar, for joining us today.
Thank you. Thank you very
Thank
much,
you very much.
Geeta.
Thank you very much.
Thank you, everybody. Good day. Bye.
Bye.
Good
Yeah.
day. Have a good day, everyone. Bye. Thank
Bye.
you.
Thank you.